Hi there, this is Dr. Rob Cywes, the Carb Addiction Doc. Yeah, but I probably am going to talk a little about carbohydrate addiction today, but I really want to focus on COVID. Some of you have heard of it, this awful pandemic virus. And let's do a reality check here. Some countries have done a really good job about slowing the spread and slowing the rate of infection. Others haven't. But the reality is this virus is here. It ain't going away. It is here to stay. Too many people have been affected by a virus that is too virulent for stay at home to work long term. Now, if you're wealthy enough to own a little island in the middle of the Caribbean that nobody ever comes to or knows about, you might stay safe for the rest of your life. But all of us pretty much are going to come into connection with this virus. The ideal ways to approach this is, number one, to prolong your exposure, your lack of exposure, for as long as you possibly can, so that the healthcare system can understand the disease a little bit. Maybe there's a vaccine, maybe there isn't. You still get the flu when you get vaccinated. So I'm not, although it's going to be very useful, I'm not depending on a vaccine. But the deeper into the course of this pandemic you can go, the more we doctors are going to know about the disease, the better we're going to be able to treat you. And the less pressure there is on the healthcare system, so they can treat you as an individual rather than being overwhelmed by a cluster. So the longer you can go, the better. The second part is the smaller dose of exposure you have, the more your immune system can fight that little battle instead of fighting this massive war all at once. So, for example, if I'm operating on somebody, an airborne virus during surgery is the worst way to get this. Is while we're cutting people, you get this massive amount of viral load that comes out of you. Or if you're leaning over someone trying to intubate them and they cough on you, you get this instant exposure of a massive load. No matter how healthy you are, your body is going to struggle with that overwhelming dose. But if you just get a small dose by getting breathed on or by touching a surface and touching your mouth, those smaller doses may help you. Now, please don't go out and intentionally do that. But the smaller the dose, the more equipped you're going to be to fight this. However, there's something that absolutely every one of us can do. Despite those uncontrollable factors, there's something that is in the control of every single one of us that is overwhelmingly, the most impactful thing you can do as an individual as we emerge from lockdown to reduce not the risk of infection, but to reduce the severity of disease should we get infected. You've heard about people who test positive who didn't even know they had it or have a fever for a few days, and then you get people that just get sick and crash and burn and die. They get strokes now without even knowing that they're sick. They get awful lung disease. What's the distinguishing factor? The distinguishing factor is metabolic health. Metabolic health. So we look at these categories. And it's fat people, it's diabetics, it's obesity, it's diabetes, it's cardiovascular risk, it's hypertension. Those are what we see. Let's take that back. The eye of the needle is insulin resistance. The eye of the needle to all of those conditions. Most cardiovascular disease, most hypertension, most obesity, all of type 2 diabetes. Not all of obesity, all of type 2 diabetes. The eye of that needle is insulin resistance. And what causes insulin resistance? Exclusively chronic excessive carbohydrate consumption. So if your obesity or your diabetes or your metabolic health wasn't enough of a trigger, now we have this added risk of severity of disease under COVID. Whether you die of a stroke at home because COVID has activated clotting in your blood system because your blood system is unhealthy, whether your immune system is distracted and fighting battles elsewhere or overwhelmed more readily because of the intravascular inflammation, and insulin resistance equals inflammation everywhere in your body, the single best thing you can do to mitigate your risk is to become insulin sensitive. And every day that you do not consume carbohydrates is a day toward insulin sensitivity. Every day is a day toward insulin sensitivity. So if you can hold off on accessing the virus by staying in lockdown just a little bit longer, but get rid of the carbohydrates from your environment. Eat as much meat, as much vegetables, as much fat as you can. I don't care about the quantity. Get rid of the sugar and the starch, restore insulin sensitivity, and even if you're still fat, it's not about being fat, it's about being insulin resistant. Your type 2 diabetes goes away well before you lose a lot of weight. Your blood pressure comes crashing down very, very quickly. Your cardiovascular risk gets better much, much quicker. We've seen this with smokers where 6 months of quitting smoking reduces cardiovascular plaque by 50% in 6 months. That is even further accelerated in terms of intravascular damage from chronic excessive carbohydrate consumption. The single best thing you can do is to remove carbohydrates from your life and preferably replace them with physical activity. Take the dog for a walk, walk down to the mailbox, become more physically active as a replacement for the addiction of carbohydrates as an emotion management system. But I cannot stress this hard enough. Take the pressure off us doctors. Help us out. So that when you do come to the hospital with coronavirus, you're less likely to stress us out by having to go on the ventilator, having to go on heart-lung bypass, having to chop your legs off, having to chop your arms off because you're clotting, having to take stroke blood clots out of your brain, large vessel strokes, because COVID has piggybacked onto your insulin resistance and caused you to die. Please, 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 folks, get rid of sugar and starch from your environment. Save yourself. Thank you.